Cumberland County is extending a helping hand to homeless adults who have mental health issues. The PATH program is part of the county's Community Development Department. PATH stands for Projects for Assistance in Transition from Homelessness. We learn more about this program from social workers Shaunee Gunnings and Shakeisha McClain.
PATH stands for Projects in Assistance of Transition from Homelessness, and it actually is a federal grant program offered through the Department of Health and Human Services. PATH's overall mission is to assist people that are homeless with serious mental illness that are not connected to mental health services. Our main goal is to assist them with getting connected to services, dealing with housing, mental health, benefits with DSS, jobs, any type of linking or coordination that they may need. Well, what we do is we do accept referrals. We also go out in the community and do outreach. So anywhere where the homeless is, we can go there. Streets, bridges, camps, churches, feeding places, we go there.
I feel that we do have a lot of challenges, one being the housing piece. It's kind of difficult to find housing that the homeless can afford. But what we have done is we've gone out into the community and we've developed great rapport with a certain people. And so we have success in that. Sometimes we find that our homeless population runs into, well, your application is going to be denied because perhaps you had a felony, perhaps your credit is bad, and things like that. So that's why we found it very important to go out and find people that are willing to work with the population that we work with. Another challenge is just getting the mentally ill homeless to trust that, you know what, you've been living on the streets all this time, it is okay for you to have your own. And so that's where maybe our counseling and our big hearts come in to kind of just, shelter them and, prepare them for something better in life.
So we have 4 staff members. We have myself, Shaunee Gunnings, I'm the team lead. We have Shakeisha McClain, which is our other PATH case manager. We have Tracy Miller, she is our PATH SOAR benefit specialist. And then we have Carlicio Davis, and he is our peer support specialist. The qualifications, it can be co-occurring, meaning you can be mentally ill and substance abuse. We don't necessarily require that you already have that diagnosis. It does help, so it'll make the process go a little faster as to what services they may need.
We have many young people that have children, and we've taken them off the street or from wherever they came from, and we were able to get them housing. Maybe they had Social Security income or they had a job. We found them places to work, and they were appreciative of that service that we provided, and to this day they're still in the housing that we have helped them to get, and they're doing very well. We're not in the business of just putting people in housing. We're wanting success stories. We're wanting them to come and be able to maintain even with their mental illness. If you have a mental illness that's, you're not able to just stay because the mental illness is flaring up, then it's our job then to help you to transition to mental health services so that they can come in and help. All of us professionals are working together, the PATH team along with everybody else, that we can make sure that we have more success stories in this county.
We can be reached at 707 Executive Place, and then we have a PATH line, 323-6148. We've actually gotten calls from people that say, hey, I have a family member, this is what the situation is, can you help us? Even if we can't help them, we may be able to refer them to a resource that may be able to assist them. We definitely want to let people know that we connect and collaborate with resources in the community, and that we always want to try and do the best we can to assist those that are mentally ill, to try and get them back into society where they need to be.
I think the most important thing for the public to understand about the PATH program is, first of all, to know who we serve. It's very important. We get a lot of referrals that we have to kind of turn away and say, no, we're really not the program for you. But, I would love the public to know that PATH is a program that assists the mentally ill, literally homeless. That's our typical client. They have to be homeless, they have to have a serious mental illness, and they cannot already be connected to mental health services because our goal is to transition them to mental health services.